We truly need more nurse scientists to continue to produce the research that can be used as evidence to bring about change and make patient care and the lives of people needing care better, including their families. There's two things that are really run the engine in Pittsburgh. It's healthcare and it's our universities. And it's a great place to develop the brightest and the best, isn't it?
We have access to amazing hospital systems. So we have University of Pittsburgh Medical Center, we have Allegheny Health Network, and students throughout their experience are placed at different locations so they get a taste of each of the main hospital systems.
4 objectives. We're going to recognize ableism and talk about what that is. We're going to look at some disabilities.
Some of our students have backgrounds in finance, in arts, kinesiology. They take some prerequisites and they enroll in our program and they're nurses within 12 to 16 months. Job placement for our graduates is not an issue. It's actually really exciting because a lot of our students, whether it's in-state, local, or outside of the state, they're really getting the jobs that they want.
So what do you think are some ways that you could make those changes?
Among our 3 nurse practitioner tracks, we're very proud of our 100% pass rate. And I believe that that comes from the program directors who are excellent educators. As faculty, our mission is to serve God by serving students, and in turn, we teach our students to serve the underserved. So one opportunity that we have within the School of Nursing is a faculty practice at the Ohio Valley Health Center. It is essentially a nurse practitioner managed clinic. I cannot quantify the number of students that I have precepted in this setting, but I do know this, that the majority of them have gone on to continue to work in underserved areas.
Yes, this is going to apply to my information and the data that I've collected so far.
The Doctor of Nursing Practice program that we have at Duquesne University is an online asynchronous program.
So yeah, I took a look at the literature you sent over.
They can have a competitive advantage, I would say, of having their D&P degree if they are seeking to further their career in a management pathway. So they may be right now at a manager level, but they're looking to get promoted to a director, all the way up to a chief nursing officer or chief nursing executive.
Should the literature review be a part more of like chapter 2?
We have a doctorate of nursing practice, and part of their role is to use the evidence that's already been created to bring about change in nursing practice. So what PhDs do is create the evidence that can be used, create the research that can be used as evidence to bring about change in nursing, to guide nursing practice. The inspiration and the spark for a PhD in nursing ethics, it actually came from our dean, Mary Ellen Glasgow. This is very in line with the Catholic teaching in charism, that we should be in this space. To be able to consult with someone who has a PhD in nursing ethics, who brings not only the ethical piece, but this wonderful understanding of nursing science, and be able to help problem solve, because in ethics, there's no really right or wrong answer. And it has to do with being able to assist individuals, families, groups, and populations on how to make the right decision for them in their cultural context.
Take another deep breath.
There we go.
I think our biggest strength is how we coach our students, how we're available to them, and how we assist them along the way.
It's a very rigorous program, and students tell us that, but we're going to be with you every step of the way.